Alrighty, everybody, let's try this again. Infectious diseases. Um, and thankfully, it sounds like I've got my voice back, so hopefully you'll be able to understand me a little bit more going forward. So talking about transmission, I feel like we've all kind of been living in the world of infectious diseases for the last couple of years, so I've learned a lot more than we probably ever really wanted to know. Airborne is a little sticky. There can be true airborne transmission, which means that the particles are a lot smaller, versus droplets, which are a lot bigger particles. So they pass through things, so they can't pass through as much of a barrier. So droplets are more like when I speak and such. Some of those molecules that are coming out. Direct contact, obviously, like touching, bloodborne, water, and foodborne. I'd also add vector-borne into that, like we had talked about a couple weeks ago, like, through mosquitoes or other rodents. So like with any illness or disease, prevention is always best. Okay, so universal precautions and sanitation measures can prevent most transmission. Okay, obviously good personal hygiene is critical. I would hope that we didn't need a worldwide pandemic for multiple years to recognize that it's important to wash our hands. Just saying. And then proper nutrition and rest are great, like immune support. So many people ask me what they can do to help keep themselves healthy. And as we mentioned on the last slide, good nutrition and sleep are huge. And oftentimes, as medical professionals, we're not very good at practicing this. I distinctly remember being a night shift nurse and counseling people about, if you want to avoid another heart attack, then to, exercise and, eat a heart-healthy diet as I, drink my Monster and eat my Pop-Tart as I run down the hallway. So it's important to practice what we preach. But really the best thing people can do to help prevent themselves from getting sick is vaccination. Okay. There is not another topic in medicine that has been as widely researched as vaccines. Okay. And unfortunately, like not just with the COVID vaccine, but with lots of different vaccines, more and more people are choosing to not vaccinate their children, which means that we're going to see some of these vaccine presentable diseases come up again, which is hard, obviously. Let's see. Influenza vaccines are a really important example of this. And it's important to keep in mind, okay, number one, what is influenza? Influenza is that, ridiculous cough with sky-high fevers and body aches and chills and supreme fatigue. It is not nausea, vomiting, and diarrhea. Okay, that's gastroenteritis. So people call that like the stomach flu. That's not the same, okay? And then it's also important that you think of influenza vaccines over a lifetime basis as opposed to year to year. So this year's flu vaccine, probably they started working on it maybe February of last year, something like that. And it's truly a guess. They say these are the 4 strains of influenza that we think are going to be most prevalent. It is 100% a guess. And some years they get it absolutely wrong, okay? But what we do know is that some of that immunity lasts from year to year. Okay, so if I've been getting my flu shot for 10 years, I potentially have some level of immunity to 40 different strains of influenza. Obviously, it's less than that because there's duplicates and such like that. But so it's important to try to judge it over like a lifetime as opposed to from year to year. So as healthcare providers, we're responsible to report certain conditions to public health authorities in order to try to help prevent further outbreaks. Obviously, COVID is one of them. STIs are a big one, tuberculosis, those kinds of things. And on here it says that the disease, not the person, is reported to the appropriate agency. That's, kind of not true in that, like, in particular, as we've all noticed with like COVID, like there's contact tracing that goes on and those kinds of things. So obviously they have to know specifically who it is. So COVID is a little bit of an exception. So influenza, it's a lot bigger deal than a lot of people think it is. 49,000 deaths and 200,000 hospitalizations each year. Two main types, A and B viruses, and people are contagious before they have symptoms and up to even 7 days after they realize that they're sick. So mononucleosis is also called the kissing disease, caused by Epstein-Barr. Oropharyngeal contact is how it's spread, which could be like, sharing a drink or something. And complaints are sore throat and overwhelming fatigue, even if they're sleeping like a bunch. I don't know what your guys' equivalent is to this, but in grad school or like NP school, we have OSCEs, which are observed structured clinical exams, or maybe observed student clinical, I don't know, one of those. Anyways, it's essentially like you have a mock patient and you have to go in, get the history, do the physical, diagnose, and then treat, okay? And the first time I had to do it, the diagnosis was mono. And I missed it. And I missed it because I thought this was just, a normal 11-year-old girl with, like a viral pharyngitis. And why it's so important that we don't miss this is the splenomegaly. Okay, so if potentially I missed that, that little girl actually had mono and she had an enlarged spleen and she plays soccer or something else like that, and she's like, oh, it's not that bad, I'm just going to go out and play, she could rupture her spleen. Okay, so super, super important. And I learned through that process, and obviously now I'm not going to miss it again. This is what it would look like with that enlarged spleen. So when you do your abdominal palpation, you can feel it. So mumps, contagious viral disease with the enlarged parotid and salivary glands. Most of the time in children 5 to 15 years old, 2 to 3 week incubation period. Why we care about it is it can cause infertility in men, okay? Because there's some swelling of the testicle as well that can reduce sperm count. And so like if you're infected with mumps as a child, you can then later on in life when you decide to try to have kids, you can learn that you're infertile. Rubella is also known as measles or red measles. It's one of the most contagious diseases out there. Until recently, measles was pretty much unheard of, but because there's a lot more vaccine resistance, it's making a comeback. It's spread through those airborne droplets from nasal or throat secretions of infected people. The incubation period is typically about 10 days, and then you're most contagious 3 to 5 days before the rash. And people are like really uncomfortable with the measles. It's no small thing. Like, yeah, it's probably not going to kill you, but boy, are you miserable. Okay. These are some examples of, incubation periods and mode of transmission, as well as, how long the symptoms persist. Rubella is also known as the German measles or the 3-day measles. It's the contagious, really mild symptoms, but we care so much is because it's so dangerous to pregnant women. Okay. Can cause stillbirth or really dramatic birth defects. And so this is a prime example of we vaccinate the entire population in order to protect a small percentage. Okay. And oftentimes, even in early pregnancy, women are actually tested for rubella immunity in order to ensure. Okay, so chickenpox and shingles. I'm on the tail end of the generations that we actually got chickenpox as opposed to being vaccinated against it. Chickenpox is pretty miserable. It's really scratchy and itchy, and if you scratch at them, you'll scar. And then that varicella virus can go dormant in the dorsal ganglia of your spinal nerves and then pop back up during times of stress or if you're taking certain medicines. And so that's when the lesions or the rash that you get follow a specific dermatome, and that's pretty hallmark for shingles. And the problem with shingles is it can leave like permanent nerve pain in people following that dermatome. Okay. Oh, and the vesicles or the lesions that you get with chickenpox, they get crusty and secrete this nasty fluid, and anything that fluid touches is contagious because it's just full of virus. Hepatitis literally means inflammation of the liver. A lot of different types with different, ways of developing it. Can be caused by bacteria, viruses, drugs, toxins, excessive alcohol abuse. So normal liver location, okay, right upper quadrant, really under those rib cages. These are the different types of hepatitis. Hepatitis A typically spread oral fecal route, so people not washing their hands and then preparing food or contaminated food or water. It's a clinical illness and you have like ridiculous diarrhea associated with it. Hepatitis B, more common with infected blood or blood products, sexual contact. And chronic hepatitis B increases your risk of cirrhosis and liver cancer, so something to keep in mind. Hepatitis C, and we do have vaccines to prevent against hepatitis A and B. The amount of immunity response created by the hepatitis B vaccine really varies, so oftentimes people have to get titers to confirm that they do have immunity. Hepatitis C, unfortunately, we do not have a vaccine for, but we do have a treatment now, which is amazing. And so we have to, it's the current recommendation that people are screened at least once in their lifetime for hepatitis C, so that if we discover they have it, they can be sent on for treatment. And so it's important that we screen people at the correct time in their life, okay? So, it's not as beneficial to screen an 18-year-old who may be having multiple sexual partners or maybe experimenting with other things like IV drug use, as opposed to an older person who's not participating in those events. Obviously, that's a gross overgeneralization because it's possible for anybody to participate in these activities to get exposed, but statistically speaking, it's more likely in the younger years. Okay, so I think we just kind of covered this. Mostly occurs more often in crowded areas through contaminated food or water. Oftentimes, I see this in patients when they come from other countries, okay, or they vacationed somewhere else. Like I said, this is vaccine preventable. Hepatitis B is pretty widespread. About a third of the Earth's population is infected, primarily through sexual activity, IV drug use, even piercings, tattooing, those kinds of things. It is absolutely an occupational hazard for healthcare workers, so it is recommended that you have the vaccine as well as proof that you've had good immunity. And the struggle with hepatitis B too is that it can live for a long time outside of the human host, even just on a table or something like that. So that's part of why there's such strict cleansing recommendations. Hepatitis C is one of the main causes of liver disorders. Close to 20% of chronic hepatitis C carriers develop cirrhosis, and then they can even go on to hepatic cancer. Only protection we have is avoiding those risky behaviors, but luckily, like I said, we do have a cure for hepatitis C. Hepatitis D, not really that common. Okay, sometimes it comes along with hepatitis B, but hepatitis B immunization helps prevent D. So, honestly, in my clinical experience, I've never even heard of this. So streptococcal infections. The streptococcal bacteria are commonly found all over our body. Okay, GI tract, throat, respiratory system, GU, skin, and it only really becomes a problem when it's occurring somewhere other than it should. It's one of the most common infections, but also really dangerous and is spread from person-to-person contact. These are just a whole bunch of different types of streptococcal organisms and where they normally occur, and then what diseases they can cause. Okay. So this is just another example to keep in mind that normal, like streptococcal infections, can cause a little bit of everything from pneumonia to sepsis to UTI, endocarditis to ear infections, rheumatic heart disease, necrotizing fasciitis. It's quite a broad spectrum. Group A strep is more common for the tonsillitis, pharyngitis, pneumonia, cellulitis. It can also cause a form of gangrene called necrotizing fasciitis, which is flesh-eating bacteria. And if you want to have nightmares, Google it. It's gnarly looking. Group B strep can cause infections in the heart, in the joints, even sepsis in a postpartum mom, pneumonia, meningitis in the newborn baby. It's a big struggle. Normally found in the upper respiratory, GI, and female GU tracts. Two different types of streptococcal that, like I said, really I think the take home here is that like a lot of things can be caused by strep. Okay. And then versus staphylococcal organisms, they always call them grape-like clusters, and I really don't get it. But anyways, I guess they look like a grape cluster. This is transmitted most of the time through hand-to-hand contact during patient care, but also can be airborne. Most of the time, these are causing like benign skin wounds, like infections and post-surgical infections in your athletes. These are some of the different Staphylococcus. Mrsa is a big one to keep in mind. And Mrsa essentially is just meaning that type of Staph aureus is resistant to methicillin. And why we care and why people get so worked up about antibiotic resistance and such like that is there's new medicines being developed all the time in healthcare, in particular in America, but not new antibiotics. Okay. It costs a lot of money to develop a medication, okay, between trials and testing and all these other things. And it's more lucrative for a drug company to develop a medicine for your high blood pressure that you're going to take for 40 years versus an antibiotic that you may take once every couple years. So the struggle is that we're not getting a bunch of new antibiotics, and so we need to be resourceful and wise with the ones that we have. So this is why we want to keep a close eye on Mrsa as well. Mrsa begins as a small lesion that often people think is just a pimple, and then it gets a lot bigger and redder and angrier from there. A big risk factor for Mrsa is if you've had antibiotics recently. But some people, the Staph aureus that just lives on their skin is resistant. And is also like painful beyond expectation for the type of pain a similar wound would cause. And so this is often why if there's any type of drainage, we will culture it so we know specifically what antibiotic to use to kill those bugs. Lots of different things can transmit Mrsa: towels, water bottles, hot packs, Velcro, weights. obviously the list goes on and on. So all sorts of different things that we use all the time can just be a breeding ground for this. And it continues. Paraffin baths, freezable gel packs. This is why those sanitary processes are so important. We all find places that we cut corners in healthcare to make ourselves faster. This is one we've got to be really careful about. Encephalitis, literally inflammation of the brain, can be from a lot of different things. Viral causes. Very, very rarely it can be a sequelae of immunizations or vaccines. You can also have like hepatic encephalitis. Primary is caused by direct viral invasion versus secondary is a result of a viral infection elsewhere in the body. Zika virus is one that we heard an awful lot about maybe 6-7 years ago. It's transmitted by a certain type of mosquito, and really like the illness it causes is pretty benign and nothing to write home about, and a lot of people don't even know that they got sick. But pregnancy, and if a pregnant mom gets infected with Zika, she can miscarry, or her baby could essentially be born with only a brainstem, okay, with like microcephaly. And if the baby does live to term, to be born, they typically only live a couple hours after delivery. Viral meningitis, most common form, inflammation of the meninges. As you know, pretty well managed. Symptoms last about 7 to 10 days, and people do really well. This is how you test for Brinsky's sign, which is a sign for meningitis. Okay, oftentimes people get like neck stiffness. Versus acute bacterial meningitis is one of the scarier ones out there, and this is one I worry about because you can go from perfectly healthy to dead in a couple days. And I typically like diseases that give me a little bit more time to figure out what's going on. Okay, and so this is we do vaccinate against this. It's one of the vaccines that is required for like close living, like in dormitories and such. And this is why, because it spreads so easily and it can kill you so fast. If you do survive, can result in permanent brain damage, hearing loss, learning disability, limb amputation, kidney failure. It's a nasty one. It's one we don't want to mess around with. I find this really funny because this is essentially how you interpret lumbar taps in order to help diagnose meningitis and some other things. Please no one attempt a lumbar tap on anybody.